Hello and welcome. Today we're diving deep into a fascinating, though sometimes challenging, condition type 2 renal tubular acidosis, also known as proximal renal tubular acidosis. We'll break down what it is, why it happens, and how it's managed. So, let's get started. So, what exactly causes type 2 RTA? Well, it's often due to a defect in the proximal tubules of the kidneys. This defect prevents the kidneys from properly reabsorbing bicarbonate from the filtered blood back into the bloodstream. This can be caused by a variety of factors, including genetic disorders, certain medications like carbonic anhydrase inhibitors or outdated tetracycline, multiple myeloma, Fanconi syndrome, heavy metal poisoning, or even kidney transplants. In some cases, the cause remains unknown, which we classify as idiopathic. Let's understand the pathophysiology. Normally, the proximal tubules are responsible for reabsorbing about 80–90% of the bicarbonate filtered by the glomerulus. In type 2 RTA, this reabsorption is impaired. This impaired reabsorption leads to increased bicarbonate excretion in the urine. Because bicarbonate is a base, losing it in the urine causes a buildup of acid in the blood, leading to metabolic acidosis. The body tries to compensate by breathing faster to eliminate carbon dioxide, an acidic gas, but this isn't always enough. The persistent acidosis can also affect bone health and growth in children. Type 2 RTA is relatively rare compared to other types of renal tubular acidosis. Exact prevalence rates are difficult to determine because it often occurs as part of a broader syndrome like Fanconi syndrome. It can affect individuals of any age, but it's often diagnosed in childhood, especially when it's associated with a genetic disorder. However, it's also seen in adults, often linked to medication use or underlying diseases. The signs and symptoms of type 2 RTA can vary depending on the severity of the condition. Common symptoms include failure to thrive in infants and children, slow growth, bone problems like rickets or osteomalacia due to impaired calcium and phosphate handling, muscle weakness, fatigue, vomiting, and dehydration. Some individuals may also experience kidney stones, which can cause significant pain and discomfort. In severe cases, untreated RTA can lead to neurological problems and even coma. Diagnosing type 2 RTA involves a combination of blood and urine tests. Key findings include a low serum bicarbonate level, indicating metabolic acidosis. Urine pH might be inappropriately high alkaline despite the acidic blood because the kidney is unable to effectively reabsorb bicarbonate. A fractional excretion of bicarbonate calculation can confirm the bicarbonate wasting in the urine. Doctors will also investigate the underlying cause through a thorough medical history, physical examination, and potentially genetic testing if a hereditary condition is suspected. Other tests might be done to rule out other conditions with similar symptoms. While we primarily classify RTA into four main types, types 1–4 within type 2, the classification is more about the cause of the proximal tubular dysfunction. It can be primary due to a genetic defect or secondary due to other conditions like Fanconi syndrome or medication use. Understanding the underlying cause is crucial for effective management. The primary goal of treatment for type 2 RTA is to correct the metabolic acidosis and address the underlying cause, if possible. This typically involves oral bicarbonate supplementation to replenish the lost bicarbonate and neutralize the acid in the blood. The dosage of bicarbonate needs to be individualized based on the severity of the acidosis. In cases where the RTA is due to a medication, stopping the medication is crucial. Additionally, treatment may include supplements to address any associated electrolyte imbalances, such as potassium or phosphate deficiencies. If bone disease is present, vitamin D and calcium supplements may be necessary. Preventing type 2 RT often depends on the underlying cause. For example, avoiding nephrotoxic medications can help prevent drug-induced RTA. Genetic counseling may be beneficial for families with a history of inherited RTA. Early detection and management of underlying conditions like Fanconi syndrome can also help prevent or minimize the severity of type 2 RTA. The prognosis for type 2 RTA depends on the underlying cause and the effectiveness of treatment. With proper management, most individuals can lead relatively normal lives. However, untreated or poorly managed RTA can lead to serious complications, such as growth retardation, bone disease, kidney stones, and even kidney failure. Recent research has focused on identifying the specific genetic mutations associated with inherited forms of RTA and developing more targeted therapies to address the underlying tubular dysfunction. Also, research continues to explore more effective ways to manage the associated electrolyte imbalances and bone disease.